This video provides instructions on how to complete an initial evaluation for the patient status type of active patient-new. Congratulations! You've received notification in the ACE messaging system that an active patient-new has been assigned to your caseload. Let's take a look at the clinical workflow for this specific task. First things first, the user must log into ACE. Whether it's the scrolling alert or the inbox message that first catches your attention regarding a new patient, the first thing to do is to tap on the inbox message and open it. The overall look of a new patient message will usually appear the same. However, the content of that message will contain information with specific, detailed, unique instructions for initiating services to that new patient. Each message is customized to the unique service requirements of the individual patient and their funding source. So it's critically important that the user follows the order of operations indicated in the message. The clinical user should use the slide bar to scroll down to read the entire message. The inbox message also has an attachment, which is a direct link to that patient's record. This is a huge efficiency measure to best utilize the time of the clinical staff. Tap on the attachment and the patient record will open. The link in the inbox message takes the user directly to the General tab on the patient record for the new patient. The demographic information for the patient and caregiver is readily visible, and the user is able to call and schedule the first appointment while those unique requirements identified on the inbox message are still top of the mind. We're going to talk more about protected health information status later in our training, but this new patient shows a restricted PHI status, and that status shows in red. As is the typical pattern in ACE, red means stop. A restricted PHI status in ACE means that there are one or more individuals excluded from receiving or hearing information related to the patient's services. It's important to note any restrictions prior to delivering services to the patient. After getting the patient or caregiver on the telephone, the user is able to return to the ACE schedule by tapping the schedule icon in the ACE navigation bar. The clinical user will schedule the evaluation appointment. When the appointment time arrives, the user can tap on the appointment. When the scheduled day and time of the appointment arrives, the user may also obtain a caregiver signature to validate the delivery of services. This is another important compliance feature of ACE. By obtaining the signature of the caregiver present with the patient, you have confirmed that the appointment occurred in the event that there are any questions later by the family or funding source about whether the visit occurred. Tap the Caregiver Signature button. The caregiver signature box will appear. The attendant caregiver will type in their name and then will provide their signature in the space provided. When complete, the user will tap the Accept Signature button. Once a signature has been accepted, a copy of this document will be placed in the patient's EMR, confirming that services were provided on the specified date. It's important to note that the documentation of an evaluation appointment can only be initiated from the ACE schedule. Thus, if the evaluation was originally scheduled for Tuesday at 9 a.m., but was then rescheduled for Wednesday at 9 a.m., the user will need to delete the Tuesday appointment and add an evaluation appointment on Wednesday at 9 a.m. When it's time to document the evaluation, tap the appointment on your schedule. The clinical user will tap the Document button. It's important to know that ACE is programmed to save all evaluation data entered by the user cumulatively. All text and checkbox data is saved so that the user can leave the evaluation form, and when they re-enter the evaluation documentation at a later time, it will resume at the point where they left off. This is particularly helpful when the user is attempting to maximize their time management within a workday. When documenting any type of evaluation, the first thing that the clinical user is asked to do is to visually confirm the date of the evaluation. In this case, yes, the evaluation occurred on Tuesday, January 2nd, 2018. The calendar is not an active calendar. It cannot be used to change the date of the evaluation. In the event that this is not the date of the evaluation, the user will need to exit the documentation, cancel the scheduled appointment, and add an appointment on the schedule for the correct date and time. To return to the schedule, the user may simply tap the Show button located in the top left corner of the screen, which will activate the navigation bar, and then tap on the schedule to return and correct the evaluation date. When the date shown visually confirms the date of service, the clinical user will tap Continue. The clinical user will next identify the place of service for the evaluation. The primary service location is identified in the patient record on the Service Details tab. The clinical user can choose an other service location if the evaluation occurred somewhere other than the primary location identified on the patient record. Notice the drop-down box at the bottom of the form. This form identifies the specific form where the user is currently entering data. As the user moves through the ACE forms, they will utilize the drop-down box to move back to previous forms. The user should not use the drop-down box to move forward. This bears repeating. This drop-down box is used to move back to previous forms. The user should progress forward through the evaluation forms using the Continue buttons or by making appropriate selections on each form. The clinical user will next identify the type or types of evaluations performed. Based upon the selections made, ACE will internally line up the forms needed to complete the documentation for the billing of the chosen evaluation codes. Each form that the user completes adds to the cumulative clinical story that ACE is building for the patient and determines the direction that ACE will go next. Keep in mind that certain evaluation selections that are non-compliant will not be allowed for selection by the user. For example, the user may not select a speech and language evaluation and a language evaluation. This feature keeps clinical users on a path of compliance. The user will enter the duration of the evaluation in number of minutes. Next, the proficient language of the patient is identified. When the user chooses Spanish or Other, ACE will ask if an interpreter was used. The clinical user will answer yes or no to move to the next form. This text field will be used to enter the case history and reason for referral. This is the section of the evaluation that sets the stage for the clinical story that you will be telling about the patient, beginning with the demographics and the reason for the evaluation. For information about what to include in the patient case history, the user may tap the Help button. A list of clinically relevant prompts will appear to guide you through this part of the clinical history. The clinical user will tap on the drop-down box to enter a medical diagnosis that is impacting or causing the speech, language, or swallowing disorder. Notice that this is not an area to enter all medical diagnoses, only the ones that are causing the speech, language, or swallowing disorder. The user can choose to start typing in the name of the medical diagnosis, and ACE will auto-populate choices based upon the letters. Additionally, if the user is aware of the ICD-10 code, this can also be entered as well. ACE is preloaded with common medical diagnoses that impact communication, such as autism spectrum disorder, Down syndrome, cerebral palsy, sensorineural hearing loss, and many more. Occasionally, clinicians will encounter a medical diagnosis that isn't currently loaded into ACE. This is not a problem. When a user needs a medical diagnosis added, they will choose the preloaded ICD code of 000.00, which serves as a placeholder in ACE. The evaluation form will be able to continue while you reach out to a contact supervisor in your company to assist you with adding the new diagnosis. In the meantime, this placeholder code will allow you to continue completing the evaluation documentation for this patient. It's important that the user doesn't sign the evaluation with this placeholder code in place, as this will inhibit ACE from ensuring compliance with coding. Also, the user should not proceed with writing a plan of care until the correct coding is entered into ACE and the evaluation is signed. Remember, good data in equals good data out. You can complete the documentation and await word from your supervisor that the new code has been added to ACE. When you are able to select the new code in ACE, do so and continue through the evaluation forms until you can attest and sign. If you have questions about this process, please contact your supervisor. Now let's take a moment to talk about the importance of coding. ICD-10 is the 10th revision of the International Statistical Classification of Diseases and Related Health Problems, a medical classification list by the World Health Organization. It contains codes for diseases, signs and symptoms, abnormal findings, complaints, social circumstances, and external causes of injury or disease that are used by medical professionals throughout the world to consistently diagnose medical conditions. There are ICD-10 codes for both medical and clinical diagnoses. For example, a medical diagnosis that most clinicians are familiar with is autism spectrum disorder, and its ICD-10 code is F84.0. A clinical diagnosis that other clinicians are usually familiar with is developmental articulation disorder, and its ICD-10 code is F80.0. You may very well recognize the name of both of these diagnoses, but you may not be too familiar with their codes. In ACE, you will become more knowledgeable about the diagnosis codes for your patients. Diagnosis codes matter, and they're important to the documentation and billing of clinical services. For example, the American Medical Association, American Speech Language Hearing Association, Centers for Medicare and Medicaid Services, along with all health insurance funding sources, require accurate diagnosis coding. All relevant medical diagnoses are identified in the case history section of an evaluation, but only medical diagnosis codes that cause a speech, language, or swallowing disorder are coded. Examples of these organic causes of a communication or swallowing disorder include, but are not limited to, autism spectrum disorder, Down syndrome, cerebral palsy, and documented hearing loss. While a patient may have diagnoses such as prematurity or otitis media and ADHD, they are not necessarily organic diagnoses causing a speech, language, or swallowing disorder. They're developmental diagnoses. The medical diagnosis codes that you enter into ACE will set you on a path to code the correct ICD-10 classification for the clinical diagnosis. So it's important to only code those that cause the speech, language, or swallowing disorder. Our task is to code to the highest degree of specificity. When you're in doubt about a medical diagnosis, call the patient's physician. For more information about speech, language, and swallowing coding, you can find reference materials at asha.org. When there is no medical diagnosis that is causing the speech, language, or swallowing disorder, the user will tap the Continue button and an alert will appear. The user has to answer yes. I am sure that there is no medical diagnosis impacting communication or swallowing skills. The data entered on this form is a programming function for ACE that affects the clinical diagnosis options for the user at the end of the evaluation forms. This is another compliance feature of ACE that ensures that your coding is accurate to the highest level of specificity for each patient. Again, if you are unsure, contact the physician for verification. Next, the user will answer yes or no to any relevant surgeries. When yes is chosen, a text box will appear so that the clinical user can identify the relevant surgical procedure and date. The user will answer yes or no to has the patient received any known speech-language evaluations in the past 6 months? When yes is chosen, a text box will appear so that the clinical user can identify the date and details about the known evaluation. The clinical user has now entered the clinical analysis of areas assessed forms for the evaluation. The user will tap the checkbox to identify which formal or informal clinical instruments were used to assess the patient's skills. ACE is preloaded with frequently used pediatric assessments. The user will choose Other Standardized Assessment to enter test scores and clinical information for any test that is not listed. At the bottom of the ACE form, the clinical area assessed will be identified in the large navigation drop-down box. A second sub-navigation drop-down box will appear and can be used to go back to forms within the areas assessed. As a reminder, the navigation bar is for returning to forms already completed in the evaluation. It is not to be used to move forward in the evaluation. The green Continue buttons are used to advance forward within the evaluation. The user enters test score information in the fields provided. The user may double tap on the Summary Text Box field to expand the box so that the user can easily document clinical details of the patient's strengths and weaknesses. The Summary Text field allows you to enter as much or as little narrative as necessary to provide a clinically accurate picture of the patient's participation in the evaluation. This also identifies a general pattern within the clinical portal of ACE. Should the user wish to expand a smaller text box, The user may double tap, and an expanded box will appear on top of the form. When documenting an informal phonetic or phonemic inventory of a speech sample, the user can choose to document strengths and weaknesses and/or a description. Only the field with the text entered will print on the evaluation documentation. For speech and swallowing evaluations, the clinical user will address oral motor skills by using checkboxes for facial symmetry, labial range of motion and strength, and lingual range of motion. The user will also identify lingual strength, dentition, and the soft and hard palate. The oral motor assessment will conclude by identifying the jaw and respiration. The final form of each evaluation type, or each area assessed, has a comment section. This form is a text box for the clinical user to enter any clinical information that was not already provided in the instrument's utilized forms. When the clinical user is completing a language-only evaluation, this form is used to document why a speech sound assessment was not completed. Since a language-only evaluation is coded using the modifier 52, the user is required to document why a lesser service was performed. Again, this is a compliance feature of ACE that ensures support of your clinical decision to assess only the language of the patient. After all clinical information is entered into ACE, it's time for the user to provide clinical impressions by choosing whether to diagnose a disorder or identify that all areas assessed are within normal limits. Based upon the type of evaluation, ACE will open disorder areas for the clinician to diagnose. In this example, the clinical user can only diagnose an articulation and phonological speech disorder since this is a speech evaluation. When a user completes a speech and language evaluation, the language and articulation and phonological disorder areas are available for diagnosis. When there is not a medical diagnosis identified, ACE will allow the following diagnosis codes: childhood apraxia of speech and developmental articulation disorder. The user will tap the checkbox to the left of the code if they want to diagnose. Use the drop-down box to identify the severity rating and enter the onset date. When a medical diagnosis is present in ACE, ACE will allow for one of 5 speech diagnosis codes. It's the clinical judgment of the user to determine which code most appropriately describes the patient's speech disorder. The user will tap the checkbox, use the drop-down menu to identify the severity rating, and enter the onset date. The clinical user will then review all of the diagnoses assigned to the patient. This is your opportunity to confirm or edit your clinical diagnosis. If there is more than one diagnosis listed, the program will calculate the overall severity rating based upon the severities that are listed. The user will next recommend skilled SLP services or not. If services are not recommended, the user must provide details as to why services are not being recommended. When therapy is recommended by the evaluator, the frequency, intensity, and duration will be identified. The clinical user may then identify other recommended referrals when appropriate. The clinical user can provide additional information if needed. If yes is selected on this form, another text box will appear for the user to provide additional clinical information. In most instances, the user will have provided all relevant evaluation information prior to this form. When No is selected, ACE begins processing the information that you've provided. Once the user indicates that no other information needs to be added to the evaluation, the user will be asked to wait as ACE compiles the data into a professional PDF document. Once the document appears, the clinical user will review their documentation of the evaluation carefully and thoroughly. This is your opportunity to correct any errors or to provide any additional information. When a user wants to edit an evaluation after reviewing the PDF preview provided by ACE, they will use the drop-down navigation bar to go back to the evaluation form to edit. When the edits are complete, the user will use the green Continue buttons to continue to the preview of the edited evaluation. Once the evaluation review is complete and the document is accurate, the user will tap the green button. When a clinical user is assigned to go through the clinical documentation review process of ACE, they can choose to submit their evaluation for review to a clinical supervisor without a plan of care, or they can proceed to writing the plan of care. When the clinical documentation review process is not required, the clinician can still choose to submit the documentation for clinical review. We all know that occasionally it's nice to have the option of another pair of clinical eyes to take a look at an evaluation of a difficult case. ACE allows you this option. If no clinical review is desired or required, the user can sign the evaluation without review. If the user taps the green button and moves forward with writing the plan of care, both documents will be submitted for review together. This means that if the clinical user does not want to submit any documentation for review, they must sign the evaluation first so that the evaluation data will be placed in the data tables. Once the evaluation is signed, then the user can write the plan of care. As we shared earlier, ACE saves evaluation data entry cumulatively, so you can start and resume documentation of an evaluation, conveniently returning to the spot where you left off. Conversely, the plan of care must be completed in one sitting. If you leave the plan of care in the middle, the data will not save. ACE will alert the user that they must complete the plan of care in the same session that they started, and will remind them that leaving the plan of care will cause the information to be deleted if they attempt to leave it before it's signed. The user can make the choice to stay in the plan of care forms and finish the documentation, or leave the forms and write a new plan of care at a later time. The great news is that a plan of care does not take much time to complete. We'll go over that more in our next video. When an evaluation is submitted for clinical review in ACE, the appointment will appear blue on the schedule. A red evaluation appointment means that the time of the appointment has passed and that the service is undocumented. As a compliance measure, the evaluation documentation must be signed prior to providing the next treatment visit for the patient. ACE will not allow documentation of treatment until the evaluation documentation is complete and signed. Whenever the user completes evaluation documentation, it's always important to remember to sync. You may recall that syncing is the only way that your specific Ilium pod, or clinical ACE portal, can communicate with the mothership, the administrative ACE portal. If your evaluation documentation is going through a review process, the only way to send the document is to sync, And conversely, the only way to receive a reviewed evaluation is to sync again. Now that you understand how to complete an evaluation for a new patient, let's take just a few minutes to consider annual evaluations for active patients on your caseload. If a patient has a status of active patient, ACE utilizes the most recent evaluation type and date saved on the Evaluations tab for the patient, and then prompts the clinical user to consider an annual evaluation. For certain funding sources, annual evaluations are required, and for some funding sources, evaluations require pre-authorization. Your admin ACE team will assist you in determining if funding is available for an annual evaluation. ACE will send the user an inbox message and will provide a scrolling alert 2 months prior to the expiration of the current evaluation. If the evaluation has not been completed, the user will also receive a reminder 2 weeks prior to the evaluation expiration date. While ACE sends these alerts for all active patients, it's the responsibility of the clinician to consider whether an evaluation is clinically appropriate when an evaluation is not required by the funding source. Further, the clinical user should consult with the admin ACE staff responsible for billing to determine whether funding is available for the evaluation and if prior authorization is required for the service. Your admin ACE team will provide instructions based upon the unique funding arrangements for each patient. When an annual evaluation is required or appropriate, the clinical user will simply add an evaluation appointment for the patient to the ACE schedule. After completing the assessment, when the schedule turns red, the user will tap the appointment to initiate documentation of the evaluation. This concludes the evaluation instructions for clinical ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written clinical ACE manual for detailed instructions and screenshots related to specific features and tasks.